against people living with HIV/AIDS around the world, and more importantly, how best we can work together to address these issues and promote more inclusion in our societies. For Thailand, Her Royal Highness Princess Somsawali Gromamun Suthanarinath, the UNAIDS Goodwill Ambassador for HIV Prevention for Asia and the Pacific, has worked tirelessly in supporting the country's response to HIV for almost 30 years, notably in promoting the prevention of mother-to-child transmission of HIV and the introduction of the pre-exposure prophylaxis or PrEP in Thailand. Today, HIV is still one of the world's most serious public health challenges. In particular, amidst the COVID-19 pandemic, the number of people belonging to key populations who have limited access or avoid receiving appropriate treatment due to stigma and discrimination remain disconcertingly high. And if we are to achieve the SDGs for ending AIDS by 2030, the international community needs to redouble its efforts in the following areas. First, by promoting universal health coverage that places emphasis on access and affordability of essential health services. No one should be pushed into poverty owing to the expenses of essential health services. That is also in line with the UN Secretary General's report on our common agenda. Second, by strengthening national, regional, and global cooperation, including through sharing and supporting technology transfer, know-how, and sustainable funding to further enhance AIDS response capacity at all levels. Third, by transforming into reality the political commitments made under the Global AIDS Strategy 2021 to 2026 and the 2021 UNGA Political Declaration on HIV/AIDS. It is a time for action. We must end the pandemics of stigma and discrimination as we work to end AIDS more effectively. And fourth, by forging wider participation and engagement of people living with HIV, as well as local communities, in designing, shaping, and implementing approaches for HIV/AIDS prevention and service delivery, which in turn will also help address HIV-related stigma. Excellencies, ladies and gentlemen, Thailand is honored to assume the chairmanship of the UNAIDS Program Coordinating Board this year under the leadership of Deputy Prime Minister Anutin. Our team stands ready to work closely with all member states and stakeholders to chart a way forward for an even more robust global AIDS response. I would end here by thanking all panelists and participants who have joined us in solidarity in the fight against stigma and discrimination as we work towards achieving our common goal of ending AIDS as a public health threat by the year 2030. I thank you.
Thank you, Excellency.
It falls on the 1st of March every year. On this day, we celebrate the right of everyone to live a meaningful life with compassion and dignity.
Your hand like a butterfly is a symbol of the Zero Discrimination Day. Yes, we have the first shot and the second shot.
Excellency Mr. Anutin Charnvirakul, Deputy Prime Minister and Minister of Public Health, Mr. Taufik Bakali, UNAIDS Regional Director for Asia and the Pacific ad interim, Excellencies, distinguished panelists, ladies and gentlemen. At the outset, I am pleased to extend a very warm welcome to all of you to this high-level seminar, co-hosted by the Ministry of Foreign Affairs, the Ministry of Public Health, and UNAIDS. It is a particular pleasure to receive Deputy Prime Minister Anutin at our ministry once again.
The floor is yours.
Sawadee Kap, good morning from Geneva. Your Excellency.
Panel discussion. May I invite the moderator and all the panelists onto proceed onto the stage for the panel discussion.
Deputy Prime Minister,
This afternoon for you at this important event that the Royal Thai government is hosting. Unfortunately, the Executive Director, Ms. Winnie Vianemo, could not be with you.
Okay, thank you very much. We end the group photo.
Good afternoon to all. And Excellency Mr. Vishawat Isarapakdi, the Vice Minister for Foreign Affairs of Thailand, Excellencies, distinguished guests, the Regional Director for Asia and the Pacific, Mr. Tawfiq Bakali, ladies and gentlemen, we are at the last section of the milestone toward AIDS by 2030. We have to end it by that year. With only less than 8 years to achieve this target, we need to reaffirm our commitment and intensify the implementation of the 2021 political declaration on HIV and AIDS and the current global AIDS strategy. Ending inequalities is key to ending AIDS. Eliminating HIV-related stigma and discrimination is one of the key areas to ending inequalities. The high-level seminar today is organized in observance of the Zero Discrimination Day on the 1st of March and to raise awareness and enhance global commitment on eliminating HIV-related stigma and discrimination. HIV-related stigma is everywhere, at homes, workplaces, schools, health facilities, and even in the legal sectors. Consequently, many people are reluctant to seek and get services, including HIV testing, treatment, and support. Certainly, this reluctance delays the progress toward ending AIDS. Likewise, reducing discrimination is not easy as it involves changing ideas, beliefs, and values that have been deeply rooted in society for a long time, as well as changing practices, guidance, and laws that harms or hinders people accessing to HIV services. Thailand is a pioneer country to join the Global Partnership for Action to eliminate all forms of HIV-related stigma and discrimination. Government, civil society, and community of people living with HIV/AIDS and the key affected population have jointly developed Thailand Partnership Action Plan to end HIV-related stigma. To implement the plan, we will raise funding support and work with all sectors to tailor the best interventions for each setting. As the chair of the UNAIDS program coordinating board for this year, Thailand and its PCB members have placed elimination of HIV-related stigma and discrimination a priority to reduce inequalities and ending AIDS by year 2030. To achieve this ambitious goal, greater commitment, cross-sectoral coordination, and concrete actions are required to make a transformative change to ending stigma and discrimination. I believe the exchange and discussion among all of us here address distinguished panelists and participants today will enhance the global effort in achieving our goal. I thank all panelists and everyone for your effort toward ending AIDS. And I wish this seminar a very successful outcome. Thank you.
Thank you very much, Excellency. I would now like to invite Ms. who is joining us online from Geneva.